So I actually have one other announcement. So all of you who want CME for this last quarter, for your attendance for rounds, I'm doing certificates tomorrow. So make sure you have everything filled in before tomorrow. Thank you. All right. Disclosures, continuing ed, all of these cool things. Okay, have a case of a 52-year-old female, BMI about 25, has neck pain, ACDF is indicated, kind of looking for plans, do a DEXA scan, find out she has T-scores for the spine of 2.8 and femur 2.2, just as a little somewhat blurry reminder of what the T-scores look like as far as osteoporosis, osteopenia. She's not in stellar shape, right? Little bit of social history. She's married. She works with special needs students. So how do you treat her? And Brandy's not here, so y'all have to just
Has she seen
fill
her
in.
primary care doc, and like, is she on medications or?
Getting on medication, yes. So yeah, that's the plan. Other thoughts, Chris?
And if it were obviously I don't treat osteoporosis, but if it were my friend, I would recommend, getting on a calcium supplement, but also beginning significant weight-bearing exercise to improve skeletal density.
Definitely. Yeah, we actually talked about different exercise options, and she was excited about that. She likes yoga. I brought up some, Tai Chi kinds of things, and then gradually increasing on that, and that was good. She thought she could do that.
Weights, because that's the thing.
Yes, we talked about that we're going to get started on some of those things, and then actually I brought up a punching bag, and she's like, oh, I could do that. Because, I'm sure there's lots of pent-up aggression after working with children all day that are a little bit challenging, so that one was particularly exciting to her. So
I think you would, and we should probably do a better job of this, is wait to do surgery unless it was some sort of spinal cord thing. But a lot of the most of the spinal surgeries can wait until the bone density's been treated.
yeah, and that actually is the plan for her, as she's holding off on that until the bones are in a better place. Yeah. Any other thoughts?
I have a question. So how, if you're treating the osteoporosis with meditations and the other exercise and stuff, what's the length of delay for that surgery? What can she expect that she's going to have to wait before she's in a better place?
That's a really good question. Dr. Edwards?
Maybe a few months.
But it is months, not years. It's a fairly.
I don't have a perfect answer for that. And I think you would treat for a while and then repeat scans. And if the T-score is not horribly bad, and the risk with a single level cervical surgery is different than, say, a scoliosis fusion or something like that. So there's that to take into account. Also, how severe the symptoms are. But with a lot of these things, whether it's osteoporosis or obesity, I think if we can start heading in the right direction and make some improvement, that's way better than I think we've probably done in the past.
Awesome.
So I think you've already answered that she's not very active, but I think it's really important to remember that there's a difference between a bone density score and the actual bone strength, which is driven by the architecture of the bone.
Yes.
And nothing that you've got here actually tells you what that architecture is right now. And you can find out a little bit more about that using a CT, which is obviously more expensive, but could give you some insight as to how strong that bone actually is.
And that would be an excellent next step. Perfect.
One comment on that is, and I'm trying to figure out the best strategy for this, but there's general bone density, but there's also specific areas. So it's very common, for example, if bone is denser where there's loading. So if somebody has a lordotic lower back, they would load their facet joints, but the vertebral bodies might have less bone density. And so you just have to take that into consideration, and CT scan with Hounsfield units could help sort of identify, this patient has osteoporosis, but the bone density locally is actually okay. Or vice versa. They could say a T-score is okay, but the bone density for a particular segment is really not.
It's a bad place. Yeah. Keep.
One thing I was thinking about is you were talking about boxing. I used to run a boxing program for old ladies and older ladies. And I think as you read these studies, the Liftmore study, like the studies that talk about like loading and strength training, it's a progressive guided program. And I had a gal once that just went ham on a bag and she ended up breaking her hand. So I think it's important to teach people that it's not just like jump into strength training or jump into boxing. It's a progressive guided program that we need to help them through, whether it's a really good personal trainer or a therapist or something that's going to help you bridge the gap between where you are and where we want to be in a year, you know.
Beautiful. Awesome. Any other comments?
I don't know. Sometimes I think we talk about these things and it sounds so great, and then you chat with a patient and they're like, I don't have any money, right? Mm-hmm. So we're like, but find a good personal trainer and have this great, like, go work out and let me get you to a dietitian, like, it's not covered by your insurance. Like, there's so much of this. I think that there's so many barriers in medicine, and we chat about it like it's awesome. And I think a percentage of our population it is, but there's a lot that I see that I feel like, I've got this great idea for you, and they're like, I can't do that, right? And so then what do you do?
And I see a lot of people that we have to talk about finance and even just cost of groceries and how to fit things in with what the budget is that they have and do their very best. So, thank you. All right. So here's the obvious. How does food play a role?
Nutrient-dense food versus the less expensive nutrient-absent food.
Oh, you are so good. Did you see my slides? All right. So we're going to talk about ultra-processed foods in osteoporosis and spine. Way to go.
Got the right answer.
Okay, so a couple of points. First, what are ultra-processed foods? Are they all bad? And then do they really affect your spine? So we're going to talk about this from a literature perspective. So there's a scoping review that was done. There are not a lot of articles in this scoping review because there is not a lot of research. This is a newer kind of area, partly because we're just realizing what impact these ultra-processed foods have. But I wanted to start with processed foods and what the definition of a processed food is. And it's much lower level than you might think of when you typically think processed foods. So anything that changes the fundamental nature of an agricultural product. So heating, freezing, dicing, juicing, those by the US Department of Ag definition are processed foods. So if you think about this, not all processed foods are bad, right? So we've got our frozen vegetables. That's a really great thing. And I actually push frozen vegetables because it's so much easier for people to pull some vegetables out of the freezer than to keep purchasing fresh fruits and vegetables and take care of chopping and peeling and everything. Freezing, canning, drying, fermenting, freeze drying, pasteurizing, those are also processing things that make it so that we have an adequate food supply and we have things that people can eat a little bit more easily than just starting from very base. I don't know about you, but if it were not for canned beans, we would not eat beans very often because I don't remember the night before to start soaking the beans. Actually, I haven't thought about dinner the next day that early. So all of these things are really helpful. If you think about even just like a fruit smoothie, that's considered a processed food, just going from fresh or frozen fruit. Whole grain pasta. Tomato sauce, actually the processing that tomatoes go through to make sauce increases the amount of lycopene that's available, and that's an antioxidant. So tomato sauce that's been cooked and processed is actually healthier for you in terms of lycopene than just a fresh tomato. So you've got different things. Yeah, there you go, get your tomato sauce. Different things that can be extra helpful. Yogurt is a processed food because it's going through pasteurization, fermentation. Greek yogurt, they're then decreasing the water content and concentrating that protein. All of those processes actually make it a healthier food for us. So there can be some really great things with processing. And then we're going to contrast this with ultra-processed foods, which this is from the NOVA food classification system that takes from whole foods and goes through various steps to the ultra-processed foods. So they define ultra-processed as industrial formulations with little to no whole foods containing additives, preservatives, and artificial substances to enhance taste, texture, appearance, and durability. And if you look at this list, come stand on this side. Some of them are the things that you think about when you think ultra-processed foods, like soft drinks, sweetened beverages. Processed bread is one that you might not think of, and that's kind of gives you some of that spectrum, because a loaf of whole grain bread is not really a negative in terms of health, but it is considered an ultra-processed food, partly because they're, enriching and adding some of those nutrients, and part of it is, you're processing the grain that it started from and going through the baking process. Refined breakfast cereals, confectionery products, prepackaged sauces, ready-to-heat meals, processed meat products. So you kind of see that range. So why do we eat these ultra-processed foods? And this was not supposed to have come up that way. I didn't check. There was supposed to be an animation, and then all of those little choices were going to come up. Sorry, I could swear that animation was on there. Okay, think about why you eat ultra-processed foods. Think about your choices in your life. Convenience. That's probably the biggest one, right? Fatigue, good.
One thing that I don't necessarily see there is the social element of this, and then these kinds of foods are often really fun to just do with other people.
Definitely, yes.
Well, there's also we're kind of addicted to some of those foods too, right? Like they literally have chemists in these companies that put together formulations to make them more addictive. And so it's really easy, as you drive, who hasn't driven down the road and all of a sudden you're like, I smell French fries. And it is almost like a dopamine thing that happens in our mind because we are addicted to that, that salt, that sugar, that fat, those ultra processed foods. So they're also really delicious.
Yeah.
Can't be.
Yeah, they do this on purpose, definitely. Because they sell.
Economic factor, they're often, you get a lot for a little.
Yes.
So filling.
Mm-hmm. So for not very much money, somebody who's hungry can eat a lot of calories and feel better.
Going off that economic
Briefly.
thing as well is that they are when you're watching TV, do you ever see them eat your fruits and vegetables? Do they ever advertise those things? No. It's always Lay's potato chips and all those things. It's amazing the marketing that also goes into these types of foods.
Yep.
If you stopped at the doorway of any supermarket, Walmart,
Huge.
whatever, you just stop and look, and it's a sea of confections and bread and chips, and then you got to work your way back to get to the Greek yogurt, right? All the way to the back.
Yep, definitely.
So they know what they're doing.
Who's been to a school lately? What's in the vending machines? Or basically any other place that's got a vending machine. Yeah. So we have these, they're everywhere, and it's easy, and it's fast, and they taste good. And unfortunately, Oh, and they're convenient. Okay, see? There was an animation. It just didn't take the whole paragraph. I totally did that wrong. Okay. So think about the nutrition with these. Ultra-processed foods typically high in refined sugars, saturated fats, sodium, additives. They lack essential nutrients, and that's the flip side of the problem. So we don't get a lot of fiber, typically not a lot of protein. Key micronutrients, potassium, magnesium, vitamin C, D, zinc, phosphorus, B12, niacin, antioxidants. Those are ones that are typically missing from these types of foods in particular. And because we're missing those nutrients and we're getting in all of those extra sugar, fat, salt things, it impacts our health. So the obvious easy one is, yeah, this is going to increase weight, right? Because we can get in a lot of calories without noticing. I don't know that I would want to try, but in theory, you can eat like a dozen donuts really pretty quickly and easily and not notice you're full. And just because they're light and fluffy and airy, and you can just eat them. And that's a lot of calories, but if you match that same amount of calories in, say, vegetables, there's no way you could eat that many calories in vegetables without, feeling completely overstuffed. Probably couldn't even get it in anyway. So we're increasing risk of diabetes. Metabolic syndrome dramatically increases. Diabetes, heart disease, cancer, actually, as well. There are higher risks of breast, colorectal, and pancreatic cancer. So this is having a significant impact, along with the consumption of these foods has been linked to cognitive decline, psychiatric disorders, particularly anxiety and depression, inflammatory bowel disease. That one makes sense, right? Things that demyelinate in the body, like multiple sclerosis, inflammatory arthritis, and then the ones we're going to talk about a little bit today, osteoporosis, osteoarthritis, spinal stenosis, and then chronic pain. So what impact would you anticipate these ultra-processed foods might have on your spine?
Well, we already talked about loss of bone density. Inflammation.
Mm-hmm.
Secondary effect would be the increased weight, adipose tissue infiltrating the paraspinal musculature, compromising its integrity. So those are the things you're thinking about.
Definitely. Perfect.
But all the chronic conditions that come with all those things have that secondary impact on the spine or the ability to heal from injuries.
Yeah. So I want to share a couple of things from some of the studies that have been done. So looking at, first of all, college students, they noted a correlation between frequent fast food intake and low bone mineral density in both males and females. They also noted that there were a higher amount of sodium and protein in their diet, probably because this was lots of burgers, right? And then lower vitamins A and C. This one scares me. So in areas that there are a lot of fast food places around in the neighborhood, infants when they were born and young children had lower bone mineral density, and this is partly because mom's intake was lower, and then they're getting more fast food as well. So that one is a little bit kind of really super scary, and that's both bone mineral and bone mineral density and bone mineral content on those. There was a study in Portugal looking at adolescents, and they noted that lower food intake and lower nutrient-dense foods led to lower bone mineral density accrual, right, which is obvious. But it's good to kind of see that there's that correlation too, that we're missing those nutrients. And then in Korean adolescents, they noted poorer bone density with the higher ultra-processed foods. So just kind of pulling that circle together. Looking specifically at osteoporosis, the individuals with the highest quartile of ultra-processed food intake compared to the lowest had over 52% greater likelihood of having osteoporosis. And they noted that each 1% increase in ultra-processed food intake was related to a 1.9% increase in self-reported fractures. So kind of some direct relationships there. If individuals have a diet that's more than half ultra-processed foods, they had significantly lower femoral bone mineral density. There was another one looking at high intake of ultra-processed foods being associated with an increased odds of osteoporosis of 78.9%, which is pretty huge. And they did note with that study that exercise and eating more nutrient-dense foods did offset that, but that ultra-processed food still was having that really substantial effect on osteoporosis. Osteoarthritis, again, that highest quartile of ultra-processed foods, we've got a 10% increased risk in developing knee osteoarthritis. They did note that there didn't seem to be an increase in hip osteoarthritis with that study. But then replacing 20% of those ultra-processed foods with minimally processed or whole foods was linked to a 6% decrease in the risk of that knee osteoarthritis. So changing the diet, making those adjustments had a substantial benefit. In women, and this was interesting that this showed up more in the women than in the men, higher ultra-processed foods were associated with thinner cartilage, and this was pretty consistent with that, and then associated again with the osteoarthritis, which was also related to increased pain, decreased activities of daily living, and lower physical performance. And again, they looked at men as well, but this was more substantial in the women. So lumbar stenosis in a different paper. This is cool. Diets rich in fruits, vegetables, whole grains, cereals, fish, associated with a lower risk of lumbar stenosis, and a higher risk was associated with the ultra-processed foods. So they looked at both sides. You've got that relationship. And this was there were like 156 cases of lumbar stenosis and 312 case matched controls. So not gigantic study, but reasonable numbers. Chronic pain, we have a lot less solid data, but what they were kind of looking at and leaning toward is that, you've got increased amounts of sugar leading to higher insulin, CRP, and interleukin-6 levels. Salt, there's an association with the CRP in adults and elderly individuals. There seemed to be some relationship with higher trans fat levels, higher omega-6 to omega-3 ratios, and then the increase of additives seems to have an impact on chronic pain for some individuals. The points that made a lot more sense and were pretty obvious that people are replacing healthier foods with these ultra-processed foods, and so they're missing out on nutrients and micronutrients in particular that can have anti-inflammatory impacts and then decrease that risk of chronic pain. So let's go back to our 52-year-old and kind of think about a little bit more hands-on practical. So what would you do to help this patient who obviously doesn't have a lot of free time? She's probably really tired after a day of working with these kids and needs to still come up with some healthy food choices. What would you pick? What kinds of foods would you focus on? And then think about some good choices that might be in that processed or ultra-processed category even.
Maybe just having her start with okay, every meal you just grab one vegetable or fruit extra. Something raw, something easy, carrots, pears, right? Anything that's easy. It's easy to grab, easy to buy, easy to eat. Start it, and then the next time you see her, hey, let's do something else, right? So.
Perfect. Baby steps, something easy. Good.
That's why have been mentioned earlier, but I think the dietary journal would be important because then you could look at the foods that she's choosing and then try to substitute those things that are like the foods that they're eating, but obviously more nutrient dense.
Awesome. That also serves as a major deterrent. If I have to write down that candy bar, I'm not going to eat it, right? So that helps too.
Someone who has time constraints, chatting with them about meal prepping. making your meals, like for the lunches on Sunday. I don't know, do you ever give people recipes too? Yeah, right? Like, here's a sweet potato, ground beef, black bean situation with red peppers and onions or something, right? So like they can just go with that. So maybe meal prepping if she's busy.
Yeah, definitely.
I think when you talk about the ultra processed food, I think there are some good options in that. So like with my geriatric patients, I push protein drinks with them when they're in the facilities, because the food they're eating may not be something they're used to, and they don't always like it. But if I can add a little bit of extra protein with some nutrients and vitamins in there, then especially post-surgical, then I can make sure that they're at least getting something that is filling to them, but also helping in the healing process as well. And a lot of them had just never gone down that road. But it's easy when they're there that I can be like, okay, I'm going to give you twice a day a protein drink to help with that. So I think that it is an ultra processed type thing, changing a lot of things in it, but it also has some really good components, at least I feel like, to help my patients heal.
Yeah, because most of that processing is just intensified the nutrition that's in there. Yeah, good thoughts.
Economically, bringing up protein drinks, I was just recently helping my elderly parents, and they were complaining about the cost of protein drinks, and I went and looked at Ensure that they were buying, and it's in the pharmaceutical aisle for old people, right? And it's like, it's like $5 for 4 of them or something. And I take the Ensure bottle and I walk over to the bro aisle where they keep the muscle milk, and I'm like, this is the same stuff, and the muscle milk's like $1 for 5 of them, and I'm like, you need to stop buying this, and you need to start buying that.
Exactly. Yeah, we have a lot more choices now that the bro market's grown, and so it makes it easier to give people some options that are more economical, which I really appreciate too. Yeah, good.
I think it's important to just tell my patients that, look, food is not mouth entertainment. It's fuel. So sometimes we need to kind of get out of the mindset that it has to taste like French fries and all these delicious foods. Like, okay, you learn to like Greek yogurt that's unflavored. Just put some fresh berries in there, and you start getting used to it the more you try it. And I think it was Richard Simmons that said, if it tastes good, spit it out. I think that's what he said.
Do have issues with some of that, but yeah.
Following up on what Chris had brought up earlier, there's this negative social thing, but in this case, finding a partner, finding a support network could be really helpful.
Perfect. Yeah. If you've got somebody else, especially in the home, who is on board, it makes a really big difference.
I think with my mom, especially, she would be like, oh no, the doctor's going to ask about this in 2 weeks. I have to do this.
Yes.
So a follow-up would be really nice too. So
Definitely. And having the accountability to multiple people, not just, if you can have somebody in the house that you're accountable to, if you can have a friend outside of the house that you're accountable to, and a healthcare provider that you're accountable to, it makes a big difference, because they're all building that support team. And it's harder to turn down that many people by saying, I don't want to do that, because they're all going to be helping and encouraging. Other thoughts?
Just making sure that we as healthcare providers are aware of the resources for our patients, so that they can receive those. Because like Carolyn had mentioned earlier, a lot of patients I work with are all income based, and they're income fixed, right? They don't have the excess money to just go out to Whole Foods and buy $200 worth of Whole Food groceries. They turn to what is easy, because that's all they can do to survive, right? And so making sure that we know that the either the government resources or the food banks or these other areas that these people can go to get the help that they need. If we're trying to push healthy, then we need to make sure that we give them resources to do so. Because just telling them is not going to happen, but maybe showing them is the best way to do it.
Definitely. Yeah. I give people specific grocery stores to go to, and I give them resources in the community if they're at the level that they need that support. I tell them, you know, this is the kind of sales that you want to shop. This is the kind of, you know, sometimes it's not cheaper at the place that they think is going to be cheaper, and so recognizing some of those things. So yeah, giving them that whole big picture of resources.
Per calorie, convenience foods are cheaper. But pound for pound, you know, fruits and vegetables are quite a bit cheaper than a bag of potato chips. you can get a lot more pounds of apples for $5 than you can potato chips. And that's something that for me, you know, being a frugal person, it actually becomes a motivator for me to continue eating a little bit healthier as I go, yeah, well, this is actually the most affordable thing for me to fill up on. I know, you know, you couldn't tell it to look at me, but I've been trying to lose weight for a couple of years, and the first year that I thought, well, you know, I don't get that hungry for breakfast, and I work through lunch anyway. I'm just not going to eat until dinner time, which was not that hard for me personally. But I found that when I got home, I was quite hungry. And if dinner wasn't ready to go, then I wanted a convenient snack. And then I would end up overeating at the worst time of the day to do it. And before then having a large dinner. And recently I've been pivoting to where I say, okay, now I will force myself to eat during the day in between patients. But it's an apple, it's some carrots, it's some nuts, and you know, things that are more nutrient dense, less calorically dense, and that still make me feel good about my wallet. I've actually started to lose some weight more consistently with that than I did with just abstaining, and probably getting more nutrition along the way.
Yep, definitely. Okay, we're going to close up. First of all, don't let this be a downer for Halloween. Apologies. The timing was entertaining, and also recognize this is not something that you can immediately quit eating all ultra-processed foods. It's a process. It's something to kind of consider as you're making your food choices. Help your patients to see that too, that this is not an all or nothing, and especially that making those gradual steps in positive directions makes a big difference. So, thank you.